why do they develop APGAR? It's really to assess to see how the baby is doing as when it came into this world. So for APGAR, you always say it in the order. Like we always say PMS, we always say APGAR, how we say it. So A stands for what? Appearance. And it's always on a 0, 1, 2 scale. So they either get 0 points, 1 point, or 2 for each of those letters. So appearance, 0 would be what? Hands, what? Bluish. If everything is pale or cyanotic, it gets a 0. Okay. 1, if the hands and feet are blue, but the core is pink, it gets a what? 1. Good. And if the whole body's pink, what does it get? 2. Good. Now, pulse. Pulse is the next one. How are we going to assess pulse? Where are we going to assess it? Do we do radial? No. Do brachial. The book also says you assess the pulse in the umbilical. Just go for the brachial. Okay. So after I assess pulse, I'm going to count for how many seconds? It's just like vitals. Remember that? 30 seconds, right? Times by 2. If there's no pulse, what does the neonate get? 0. If it's less than 100, what does it get? If it's over 100, 2. Good. Okay. Now, if it's less than, this is just for information, if it's less than 60, what do you think you're going to do? CPR. You're doing CPR. Okay. Pulse. So what's after appearance? Pulse. Grimace. Now, grimace. What's grimace? It's really that facial, that really first cry when it comes out. Now, if there's no grimace, no like really soft cry, what's going to get? 0. Okay. If it's an okay grimace, it's not very strong, it's a what? 1. And 2, if it's a really loud grimace, and you know how when a baby cries, really loud, it kind of like hurts your ears.
Can you demonstrate that for us?
Yeah. No, so again, 0, no grimace. 1, slight grimace. 2 is a good grimace. Okay, good cry. They also talk about if they give good sneeze, a cough, or crying, or whatever loud sound, it's going to be a solid 2. Appearance, pulse, grimace. Then what's the other one? What's the other A? Activity. Now, activity. What can we do to stimulate activity? You flick the soles of their feet. You just flick it to stimulate, and they will react. They should be kind of squirming around. If they're limp, they're totally limp, they're going to get a 0. If they're moving around just a little bit, right, after you flick their feet, they're going to get a 1. But if they're moving around, resisting a little bit, they're going to get a what? Solid 2. Good. So appearance, pulse, grimace, activity, and now respirations. Respirations is really on the judgment of the cry. So if you have no cry at all, their respirations are going to get a 0. If they have somewhat of a good cry, and by just assessing their breathing, they're going to get a 1. But if they have a good cry, it's just like if I'm talking to you, so you know my airway's pain, I have adequate breathing. So same with the newborn. If they have a really good cry, it means that the breathing's good.
Could you assume if they have grimace, they're going to have healthy respirations also?
Yeah, if they have good grimace, you can assume that they're going to have good respirations. But you want to assess that, each of those separately. Okay? That's exactly what you'll do. So really, when I come to this part, I'm going to go ahead and assess APGAR. All we want you to do is say, I'm going to go ahead and assess for appearance, pulse, grimace, activity, respiration. And if the proctor wants to, he can or she can ask you, what's the point system? And you just go through the point system. Okay. Then after I do that, then what's the next step?
Clamp cut.
Clamp and cut. So your clamps here. There's always 2 clamps, right? So these clamps, you clamp them, right? And for the lab portion and stuff like that, don't clamp them because then we have to rip them off and butt. So, all right. So these are the clamps. So I'm going to clamp 6 to 8 from the newborns, right? 6 to 8 from the newborn. So go ahead, put my clamp there, 6 to 8, and then where I'm going to put this clamp? Good. 1 to 3 from there, and then what am I going to do? Clamp it, and what are you doing? When you clamp this, you shouldn't feel pulse in the middle, and then you can go ahead and cut. And with this, you either have scissors in your OB kit, or some OB kits have a scalpel. So again, you just take the pad off and cut it. Has anyone cut an umbilical cord before? No. It takes some work. It's kind of like you have to grind in there. So it's not like cutting paper or anything. You actually have to really work at it. So he knows. But so I do that. So again, clamp 6 to 8 inches. Other clamp 1 to 3 from there. Go ahead and cut.
Note on the clamps, you guys, don't actually clamp on these models. Like if some of these clamps are actually like able to work, we usually take them apart. But these things, if you put them on, they're not going to come off of the of our like fake umbilical cords. So just make sure if they actually do clamp, don't actually do it. You can just like just slide them on right there and just vocalize, 6 to 8 inches, and then 1 to 3 inches from there, and just do it like that. You don't have to actually like clamp it.
All right. So once I cut, then in reality, I wouldn't be disconnecting it from the belly button just for this model. But once I do that, then what can I do? Reassess APGAR. So, and again, for the second APGAR, that's all you have to say. You don't have to go again. APGAR stands for if you said it the first time, we know that you have it. So you just say, I'm going to reassess APGAR. Go ahead and give it to the mother. And in reality, it says assess APGAR. The minute comes out, and then 5 minutes after that. So you're assessing APGAR twice. Sound good? All right. Then once I do that, what am I waiting for next? No? What do I have to do?
Reassess after.
Tag. I already said reassess. Reassess APGAR. And then go ahead and tag the mother and baby with the mother's name. It's not mother and baby's name. It's just the mother's name and date. Okay? Once I go ahead and do that, then I always think like, it sounds bad, but I just think tag and bag. Right? Tag it, and then you wait for the placenta. In reality, how long does it take after the newborn is delivered for the placenta to come out? 5 to 20 minutes, right? And in reality, are we going to wait around for this? No, we're just going to go ahead and transport. But for this still, go ahead and say the placenta is delivered. So this is the placenta, if you can imagine, taking a Ziploc bag and filling it with a bunch of strawberries. It's just like this, like, monster-looking thing. It's weird. So, did you guys see the video yet? No. It's pretty cool. Yeah, cool. It's pretty cool.
Birth control.
Yeah. So and then you're gonna take the placenta. What can we do with the placenta?
Fry it up.
Yeah, fry it up. Nice. I think actually some cultures do that.
You
But
have to bag
anyways,
it, don't you?
what's that?
You have to bag it and bring
Bag it, right? Tag it and bag it and bag it. And as I'm bagging it, what can I do? I can assess it, looking for any rips, tears, anything like that. Okay. And then we're gonna bag it and then bring it with the mother, because why? Because they can do tests on it and when it gets to the hospital and make sure that everything is okay. Once I do that, go ahead and put it off to the side. Go ahead and transport the placenta. I'm going to go ahead and check for perfused bleeding. And again, the amount of blood lost during labor is about 500 cc or milliliters. Okay. So then put this pad. This is a really old pad, but nice thick pad. Put it up here, put some gentle pressure on it, make sure to control the bleeding. And then what's the next thing? Once I do that, massage the fundus. Fundus is really, now that uterus after 9 months is expanded, right? So what we need to do is massage it every 5 minutes. And it's like this really hard grapefruit that you're trying to massage and bring down. By massaging it, what are you doing?
Stopping contractions.
What's that?
Contractions.
Exactly. With actually the help of the contractions, it's closing down the uterus and bringing it down to the size it was before the baby was there, and it's stopping bleeding. So it's an important thing. And actually, the thing I forgot to mention, when you give the baby to the mother, what can you encourage her to do? Breastfeed, because it releases what hormone? Oxytocin, right? Oxytocin helps close down the uterine wall and helps overall stop bleeding. And then again, going back, massage the fundus every 5 minutes, and go ahead and transport. Any questions? So it's a lot of verbalization, making sure